therapy training, we are actively disincentivized to problem solve with our patients. We're not there to solve your problems. So when I was like a second year psychiatry resident, and I had this 16-week therapy course where I'm learning the basics of therapy. And, one of the teachers came in and was like, if a patient walks in and says, "Can you help me find a girlfriend?" What's the right answer? And then the right answer is that, help me understand why you think you can't find one. Help me understand why you want one. Let's talk about it. The answer is not yes, right? So as therapists, we're not very good as a whole profession at like helping people solve problems. And I think especially if you look at men, there's a lot of disturbing data on diseases of despair. So between, I think, like 2009 and 2018, suicide-related diagnoses in people under the age of 18 went up by 287%. So what's happening right now, especially if you look at male mental health, is we're starting to realize that there's another study, for example, that there are a couple of studies that show that somewhere between 37 and 66.7% of men who commit suicide, somewhere between 37 and 66%, have no history of mental illness. So what we're starting to realize is there's a very troubling signal that we're seeing that people who kill themselves may not be mentally ill. They may actually have a life that they've just mentally checked out on. They've looked at their situation, they've tried to fix it, and they just have nowhere to go. And we're seeing this especially as we see things like changes in our economic situation, changes in employment or underemployment. Tell me about your life. I'm 30 years old. I have no job. I've never been in a relationship. And so like, what would this person look forward to, right? And so a big part of helping them is not just talking about your problems. A big part is helping them build a life. The evidence-based methods of therapy for diagnoses that are predominantly men, we see more action. So a great example of this is something called motivational interviewing. So if you look at addictions, the majority of people who have addictions are men. And if we look at what is the best evidence-based technique, maybe not best, but one very effective evidence-based technique, it's something called motivational interviewing, which is all about getting people to do shit. It's not about talking about your feelings. We're not going to examine your dreams or things like that. It's like, you have this goal. How can I interview you in a way that increases your motivation and moves to action? So we actually see that where there are some diagnoses that are predominantly men, where the technology that we use, the therapeutic technology that we use, is action-oriented, is instrumental. And we talk about emotions and stuff, but the emotions is not the end. It's a means.
Fifth time I've had that thought this morning. And that's a rumination I have about myself or whatever. And it seems to me like